with a lot of your genetic kids or your motor delayed kids, they're going to be really hyperflex through their spine. So what I'm doing here is just gently encouraging some lumbar extension. We had just checked his STNR, and lumbar extension was really limited. So what I'm going to do is I'm actually going to lay him on his back, and I'm going to give him something to hold on to. In this case, a clinical laser. Maybe not the best thing, but I'm going to put him into almost a side posture position, do some gentle mobilizations, and then actually adjust him right there. But then I go right into some lumbar and then thoracolumbar mobilization. So he's side lying, so we're taking weight out of the equation. But then I'm using some like deep pressure, just lateral to his left, just lateral on his left side of his spine, just to the side of his spinous processes. And then I'll just go into checking some hip mobility, and then kind of opening him up, and we're going to move into some cross crawl patterning. So here we are positioning some lasers. Anytime you're doing cross crawl pattern, if you can get it on the lasers on their parietal lobes, or really on their motor strips or their corpus callosum. And in this case, we're doing some cross crawls, and with cross crawls, ideally, what we want to see are his hips come off the ground, and then his arms and shoulders come off the ground as much as possible. So here we're working to a cadence, so we're counting with him. You could really make this therapeutic or add a level to this with a metronome. So if you're working on some right hemisphere stimulation, you could have a metronome on the left side. But in this case, we are, actually Miss Allie's metronome is on the phone, so that's what's running here. So we're going to the metronome, so we have some auditory stimulation with a lot of body awareness, cross crawl, lasers on his motor strip, lasers on his parietal lobe, just making this as therapeutic as you can. So if your scope allows, always complementing things with lasers is going to make your therapy a lot more beneficial, get a lot more out of it, especially in kids like this. Energy production was a major component for this guy's rehab, and a lot of your motor kids, a lot of your developmental, just global delay, a lot of your kids with genetic variations are going to really struggle with energy production. So if you're able to get lasers on the right spot while you're doing your therapies, that's going to give you a lot more bang for your buck and make things a lot more beneficial for the kid.